So what is the actual blockage? I had in mind there that perhaps it was simply the tongue falling backwards if you're in the wrong position in bed.
It's the soft palate falling back, as well as the jaw. So with sleep apnea, there are the treatment that most people may have heard of is CPAP, continuous positive airway pressure. And the idea of CPAP is that it is a mask that either covers the nose or the nose and mouth, and it blows air through the system and therefore keeps the airway open. Now, CPAP has been around commercially for probably 40 years or so, and it is highly effective. It's just that you have to wear it, and there's a device beside the bed that is basically a compressor, and I say it blows air through a pipe into the mask. People find that uncomfortable. It dries out the mouth and the nose, and so people find it difficult to wear. There are advances on CPAP. There's a version that works more like a scuba diver's regulator, so it only works when you breathe in. It puts the pressure in, but when you breathe out, you're not breathing out against the pressure. And there's auto CPAP, which basically adjusts the pressure according to your breathing across the night. So that's again a very mechanical way of keeping an airway open. But the device, there's another device called a mandibular positioning device or a mandibular advancement device, which is essentially like a boxer's gum shield. It's fitted by a dentist, and you wear it, and because you may have a recessed jaw, it stops the jaw from falling back and closing the airway. And this has gained sort of popularity recently because it's less disruptive than wearing CPAP. But as I say, both CPAP and a well-fitted mandibular positioning device can significantly reduce the number of obstructions and therefore improve both sleep and daytime functioning. You can buy mandibular positioning devices on the internet. Basically, they're boil in the bag or boil and bite. You get a plastic mold, you bite into it, and it hardens. But they're very, very cheap, but they're also not particularly effective.
Right. So those mandibular positioning devices, are they as effective as CPAP?
If anatomically it's right for you, as say if you have a slightly recessed jaw, they are very, very effective. But again, that's not everybody. And of course, like anything, some people snore through their mouth, some people snore through their nose. And of course, if you're wearing a CPAP device that isn't well fitted, you'll get leaks from the mask. And if you just have a nasal mask and you open your mouth, of course, the airway is all connected, and so air will leak. So you need to get the right mask fitted well. And you need to wear the device, and then it will work. But as I say, for a lot of people, you'll hear, "Oh, I only wear it for the first 4 hours of the night. Then I get, annoyed with it or bored with it." So it is one of those things that requires perseverance. And you'll see on social media, people saying how horrible it is, how unsexy it is, and things like that. It's sort of rather demonized unnecessarily. So, it's an effective treatment. It just the first step is you have to go to the doctor. It's not going to cure itself. You have to go to your GP, and you have to have the severity of your sleep apnea judged and then treated.